Thank you for joining me today. In this video, you will learn more about Zyprexa. Zyprexa is a second generation antipsychotic medication. It treats schizophrenia, bipolar disorder. It's FDA approved for schizophrenia and bipolar. Bipolar has a manic episode and bipolar depression. So it treats both that, but Zyprexa do not treat dementia behavior. It treats agitation, but it's not agitation based on dementia or Parkinson. It is for psychiatric medication. There is a lab monitoring that you have to monitor. Zyprexa increases the appetite, so it has a weight gain. It will increase the weight by increasing your appetite. So as a provider, you have to monitor the weight gain, and some of the baseline monitoring include BMI, weight, and waist circumferences, blood pressure. When your weight increases, your blood pressure will increase, and this medication increases blood pressure. It also increases diabetic, because you will be eating all the time, you will be hungry, and it increases the blood sugar. So you will check the baseline blood sugar and also A1C. You will check before you begin the medication, and then you will often check to see if the weight changes, if the patient is getting more diabetic. You will check the lipid panel because it increases the weight. Personal and family history of depression, personal and family of a diabetic, cholesterol, cardiovascular disease, obesity. If the person is obese, it will increase more for their weight. If they are diabetic, it will increase that. So it has a high risk of metabolic risk compared to other psychiatric medications. So you need to do comprehensive baseline assessment before you begin the medication, and when the patient is taking the medication. So baseline monitor is recommended are supported by the joint guidelines from the American Diabetic Association and American Psychiatric Association. They recommend a baseline monitoring of the weight, blood pressure, diabetic. Okay, so you will monitor the weight gain every 4 weeks. You will check those labs before you begin the medication, after 4 weeks, and then after 8 weeks, and then after 12 weeks after initiating the medication. Quarterly wear after. Fasting glucose and A1C you will assess every 3 months, then every year. at the 3 months. So you will check the baseline before you begin. Then you will check their glucose and A1C after 3 months, and then you will check after 1 year. So every year. Lipid panel you will check at the 3 months, then you will check every 5 years. Blood pressure you will check before you begin the medication, then after 3 months, then after a year. You want to check if there is any changes is happening. Also, this medication has external parameral symptoms, which is the EBA, that is a muscle movement. That is a symptoms caused by many psychiatric medication. Prior assessment, you will use the AIMS scale, AIMS scale, to see if they have in those symptoms. And this is muscle movement, abnormal muscle movement that caused by the psychiatric medication is. So Zyprexa has one of the highest metabolic risk profile among antipsychiatric medications. So the side effects include weight gain, sedation, dizziness, dry mouth, constipation, orthostatic blood pressure that happens when the patient sit, when they are laying down or stand. Position, it depends on position that causes dizziness, and the blood pressure will drop when they sit down or when they stand up. It causes fatigue. It leads to fall if your blood pressure suddenly drops when you stand up or sit down. Also, it leads to fatigue. These effects are largely attributed to Zyprexa activity at the histamine and muscarinic receptors. So it affects histamine receptor and muscarinic receptor, and that is why these side effects are happening. The serious side effects of Zyprexa include metabolic syndrome, diabetic, EBS, and tardive dyskinesia, which is the muscle movement. It also leads to neuroleptic malignancy syndrome, increases mortality in older adults with dementia-related psychiatric or psychosis. So that is why it is contraindicated for dementia patients. It's not approved for that. Zyprexa consistently associated with a greater weight gain and metabolic dysfunction compared to most other antipsychiatric medications. So Zyprexa has Zyprexa is highly effective for acute mood stabilizer, particularly mania and agitation. I have a case study for you based on Zyprexa. when you put the medication in contact of case study, it will help it to memorize and call easily. That's why I would like to do the case study with the medication, so you can understand the contacts of the medication with the case study, and it will be easier to know in the patient's perspective, or it will give you wider outlook, wider context. So I have 29 years old female graphic designer. She's graphic designer who presented to outpatient primary care, accompanied by her husband, due to a noticeable changes in her mood and behavior over the past 6 months. So she has mood changes in the last 6 months. She has no significant past medical history, no prior psychiatric hospitalization. Family history is notable for bipolar disorder and first generation relative. So her first relative is a bipolar. She denied using alcohol, tobacco, or illicit drugs. She is not currently taking medication, prescription medication, or illegal medication. She is not pregnant, and she tested negative. So some of the symptoms that she presented with are decreased in sleep. She sleeps appropriately 3 hours per night. Increased energy, goal-directed activity, irritability, emotional liability, racing thoughts. She has racing thoughts, pressure sleep. She has a pressure sleep. She had poor concentration. Those all are the manic symptoms. All these symptoms that I am mentioning are manic. Poor concentration, impulsive and decision making, excessive online spending. Okay, difficulty functioning at work and interpersonal relationship. So she's impulsive, she's poor concentration, she has impulsiveness, decision making, she has a racing thoughts and pressure speech, she's irritable, emotional liability, increased energy, goal directive. She just want to achieve everything at once. She don't sleep that much. Those are the symptoms she has, but she deny any homicidal or suicidal. Her mental status examination revealed anxiety, irritability, labile affect, tangential thoughts process, impaired judgment, racing concentration. So she has hard time concentrating. She has a manic mixed mood episode. That's what she have. When you combine all these symptoms and mental status examination revealed that she has a manic episode. Indication: Zyprexa, a typical second generation antipsychotic medication, is approved for acute manic mixed episode associated with bipolar 1, maintenance treatment of bipolar disorder and schizophrenia. So it's maintenance for bipolar and schizophrenia and bipolar 1 acute manic and mixed episode associated with bipolar. You will choose. Why choose Zyprexa? There is a other psychiatric medication. What is the reason you choose particularly in this case are clinical. The reason you choose this medication is a clinical presentation consistent with acute manic and mood instability, and this medication is good for that. Need for a rapid symptom control. If most patient that I saw taking this medication, they were inpatient, acute manic or schizophrenia. So it controls the symptoms rapidly and improves the sleep and reduces agitation. Evidence support Zyprexa efficiency in stabilizing a mood and reducing a manic symptoms. Ability to initiate treatment safely, outpatient setting with close follow-up. So my research shows that people can take outpatient, but it has to be closely monitored. Benefits of a symptom stabilization were carefully weighed against knowing a metabolic risk with structural monitoring plan in place. So monitor plan has to be in place. Patient has to be checked, as I mentioned before, all the symptoms. You will also educate the patient about the treatment, what to expect. So purpose of this medication is to help stabilize the mood, reduce agitation and improve sleep. Take once daily, preferable at night due to sedation effect. Expected timeline. Improvement in sleep and agitation may occur within several days. Mood stabilization typically improve over several weeks. Lifestyle considerations. You will consider lifestyle, maintenance, balanced diet, and regular physical activity. So you want to educate the patient to eat healthy, to exercise more, because you want them to control the weight gain. And you want to balance the diet with the physical activity. When to seek urgent care. You will educate the patient to seek urgent care if they are having a fever, muscle rigidity, confusion, severe sedation, or rapid weight gain. the patient has to verbalize understanding and agree with the treatment plan before they discharge or before they leave the clinic. Potential side effects that are common include weight gain, increased appetite. I have seen that people who are craving for carbohydrate when they take this medication. Some of the side effects are sedation and fatigue, dry mouth and constipation, dizziness and orthostatic blood pressure. Serious but less common risks include metabolic metabolic syndrome, hyperglycemia, dyslipidemia, and EBS symptoms, neuroleptic malignancy syndrome. Those are the serious side effects, and they have to seek urgent medical attention if they see those serious side effects. As we mentioned before, you want to monitor their weight, blood pressure, glucose, lipid panel. Ongoing monitors include the weight, you want to see the mood, if their mood is improving, if their function is improving. You want to also assess the sedation level. EBS, you want to assess that. You want to see if they are taking the medication and tolerating the medication. Some of the people, when they see some of the symptoms, they may not take their medication, or when they discharge you from the hospital. I have seen those, when they discharge you from the hospital, they don't take their medication and they come back again and again and again and again. They hospitalize, and then the doctor will start the medication, educate them. They will have both pharmacology intervention and therapeutic therapy, psych therapy, like cognitive behavior therapy. And then when they discharge, they stop the follow-up. They will not take their medication, they will not check on their labs or come back. Then they will come back to the hospital. Their family or their roommates will bring them back to the emergency. So, clinical response. At a 2 weeks follow-up, the patient response improved sleep during, and now average they sleep 7 hours. So her mood improved, her sleep improved. She has reduced irritability and racing thoughts, improved ability to focus and engage daily tasks. She reports mild sedation in the initial of the medication. When you begin the medication, she reports that, which has become tolerable. She now tolerates that. No EBS symptoms noted. Treatment outcome. By 6 weeks of the therapy, the patient demonstrates that a significantly reduced the manic symptoms, improved emotional regulation, improve the occupational function. There is a mild weight gain. That's what you want to see through the patient, that they are improving, which is addressed through diet, counseling, and activity plan. She has a mild weight gain, but you want to control that with diet, counseling, and physical activity. Follow-up appointments. You advise her to continue the Zyprexa since it's working for her and since she has less symptoms. Continue at the current effective dose. Monitor weight, glucose, lipid panel. Follow-up appointment will be after 4 weeks to reassess and reevaluate her mood and side effects. You want to refer her to long-term psychiatric management if suspected bipolar disorder. You want to encourage her psychotherapy for mood awareness and relapse prevention. So my question to you as a provider, which Zyprexa considers, why Zyprexa considers an appropriate first line option for acute mood stabilizer, and what factors must be weighed when continuing it as a long-term treatment option? That's the question you ask as a provider. Why Zyprexa consider an appropriate first line option for acute mood stabilizer, and what factors must be weighed when you want to continue as a long-term treatment options. If you decide to continue long-term options, what is the risks? What are the risks to consider? Why Zyprexa is the first line of acute mood stabilizer? We talked about that earlier. We mentioned that Zyprexa is quick, rapid mood stabilizer, and some of the serious side effects that you will consider if you want to continue this medication is the serious side effects like diabetic, lipid, EBS symptoms, neuroleptic malignancy syndrome. So you will consider all that side effects when you want to consider this medication as a long-term treatment. Thank you for joining me today. This video and all the video that I bring to here is educational only. Please see your provider or doctor. I am not your doctor. I am not telling you what to do if you are a patient. Follow up with your primary care. I am just doing these videos or all my videos for educational only. Thank you for joining me today, and I would love to see you my next videos. Thank you.